My name is Dr. Brandt, and I'm a general psychiatrist here at the University of Missouri. And I'm glad that I was invited along with my colleague, Dr. Agarwal, today to talk about psychiatric complications in Parkinson's disease, because I think they're very common and they can be very challenging to treat. I'm not going to go too much into detail about all the treatment options because there really are many different options, and what treatment is best for you kind of depends a lot on your own personal medical history and your own personal mental health history as well. So what works for one person as far as medication or other treatment may not be the same as what works for someone else. Okay, so mostly I'm going to focus on depression, and like Dr. Siddiqui mentioned earlier, this is one of the more common complications, one of those symptoms that we can't see. So what happens sometimes is it goes underdiagnosed and undertreated. And the literature that I was looking at actually put the statistic more at about 40 to 50% of patients who have Parkinson's disease may also have depression. And it can develop at any stage in the course, but sometimes we do see it in that early stage. And how we diagnose it is based on clinical symptoms and interview. And sometimes we'll also use a rating scale for you to fill out to look at different possible symptoms. And the rating scales can also be used to kind of follow those symptoms even after you get that first diagnosis. So what causes depression in Parkinson's disease? And honestly, there's a lot of factors at play. So psychologically, we look at people having negative thoughts or negative attitudes about living with a chronic illness. And Dr. Siddiqui mentioned a lot of times people feel very isolated. They don't have a good support network. Environmental factors, so having a lot of physical and emotional stress that we see, with any chronic disease. And sometimes there are medications that might have side effects that can increase the risk of depression. And biologically, people who have a history of mental health problems, like Dr. Siddiqui mentioned, having had depression or other mental health problems in the past. But the same areas of the brain that we see that have some changes in Parkinson's disease are also associated with thought and emotion. So those areas of the brain affect your thinking and your emotions as well. And then we also see some changes in the neurotransmitters, the chemicals associated with mood in your brain. And those most common ones would be serotonin, norepinephrine, and dopamine. So these are the symptoms of depression that we normally see. So feeling depressed or sad, not being interested in activities that you used to enjoy, having some sleep problems, either sleeping too much or having trouble sleeping, changes in your appetite, feeling extremely tired, having a decrease in physical activity, trouble with concentration or making decisions, feeling irritable or easily irritated, feeling worthless, feeling guilty, having low self-esteem, and also at times having thoughts about harming yourself or thoughts about being dead. So just highlighting here some of the physical symptoms that we often see in depression. And I mention this because this can sometimes make it difficult to diagnose in the context of Parkinson's disease. In depression, we may see people not have good eye contact. They might speak slowly. They may have the flattened expressions. And then also the slow movements. Sometimes we see that with depression. So that can be challenging to diagnose because of those the overlap in that diagnosis. There's some more recent research that shows that people who have depression and Parkinson's may also have more short mood swings rather than constantly feeling like they have a low mood. Dr. Siddiqui mentioned having facial masking or decreased facial expressions. And the other thing just being sometimes it's hard to describe what you're feeling and how to talk about that. So I'm not going to go into these in details, but these are just kind of some of the different types of depression that as a psychiatrist I would diagnose. So major depression would be a type of depression that is associated with difficulty performing your daily tasks, may result in you having trouble with your relationships, and the symptoms last more than 2 weeks. Persistent depressive disorder is more of a mild form of depression, but it lasts more long-term. Mostly people can kind of function and continue with their daily routine. An adjustment disorder, this may be something that happens that's in response to a big emotional stressor, such as the loss of a loved one, or such as may happen when you're diagnosed with a severe illness. Symptoms of this type of depression usually last less than 2 weeks. And then seasonal affective disorder is a type of depression that's related to changes in season. So most of the time people will have these symptoms that start in the fall and continue over the winter time, and then start to improve in the springtime. And people can also have this as part of the other types of depression. But what we do know is that depression, especially when it is untreated or not adequately treated, it can make the physical symptoms of Parkinson's worse. So this is one of the really important parts of making sure to identify and treat this symptom. So, how do we go about discussing this? It can be difficult to know how to help someone who's experiencing this. And it's also important to think about what the expectations are. But also you should give your loved one unconditional love and support. And talking about this should be in a positive and honest way. It's pretty common for people to maybe reject the help at first. And this is actually pretty common. So keep trying if it doesn't seem like your loved one is willing to commit to treatment. And just a big thing to talk about is that depression is not your fault or anyone else's fault. That the person experiencing depression didn't choose to feel like this. And again, I mentioned a little earlier that Parkinson's can cause some changes in the brain chemistry, which decreases those neurotransmitter levels, which can result in the depression. What you should know, though, is that depression treatment is available. There are several different treatments that I'll mention, and the treatment is usually quite successful in just about all of the patients that have treatment for depression and Parkinson's. So just to briefly talk about some of the more common options, certainly psychotherapy or talk therapy is one of the number one things that we recommend, either by itself or in addition to medication or other types of therapies. Cognitive behavioral therapy, or CBT, has some pretty good evidence for depression and Parkinson's disease specifically. And then antidepressant medications are also very commonly used. There's a few different categories that I mentioned, the SSRIs, the SNRIs, and the atypical antidepressants. And those are some Brandt or some generic name medications listed there as well. So some people, for whatever reason, maybe medication doesn't work, or they've tried several medications and it doesn't seem to be making a difference in their depression, or maybe they're very sensitive to medications and aren't able to tolerate taking medications. Then we also have some neuromodulation modalities. So electroconvulsive therapy would be one option, and then transcranial magnetic stimulation may be another option. And again, whether you're a candidate for these types of treatments is going to depend on your own personal physical and mental health history. So, slide here with medications and therapy. And then on the left there, that is a TMS treatment, which is basically what it is. It's a magnet that moves and stimulates the prefrontal cortex of the brain. which is associated with depression. Treatments are about 5 to 10 minutes, and typically what we do at the university is 5-day-a-week treatments for about 4 weeks to start, and some patients go a little bit longer. So that, specifically in Parkinson's disease, has about equal evidence for efficacy compared to a standard antidepressant treatment. And then on the right side there, that's a patient undergoing electroconvulsive therapy. So that is a little bit more of an invasive treatment. So patients would come to the hospital, you undergo general anesthesia. The procedure itself is quite quick, only about 5 to 10 minutes. The patient is given a medication to go to sleep and also a muscle paralytic, and a seizure is induced in the brain, which is thought to release the neurochemicals that cause depression and kind of reset those neurotransmitters. And that actually has great evidence as well for treating depression. Typically that's done 2 to 3 times a week for about anywhere from 12 to 16 sessions to start, and then some people end up needing